Bismillahirrahmanirrahim. Am I audible? Muneshwar, am I audible? Tina,
Yes, sir, you are audible.
thank you. Thank you. So today's topic is osseointegration. It's a basic terminology we used to use, osseointegration. It's not osteointegration. Why osseointegration and why not osteointegration? Osteointegration is a basically trade term which companies used to use. Its original term, which was used by Pierre Brennemark, was osseointegration. It was first time used by Pierre Brennemark. As I told you, he was a orthopedician. He tried first time this dental implants and gave this terminology called osseointegration. So this concept of osseointegration, we try to discuss today what it is, and how it works for your implants. So your today's modern implants totally belong or based on this concept. According to Pierre Brennemark, it's a direct structural connection. Means see here, if you focus on this photograph, you will find that the bone is intimating directly to your whatever the alloplastic material you have been placed in your bone. It could be a pure titanium, could be an alloy of titanium, could be a ceramic form, or any other material which is biocompatible. But it's not only the structural connection, means your bone is not only, lying next to your whatever the alloplastic material is there, but whenever we put some load, means for example masticatory load over this implant, this will bear this will bear the load and allow your alloplastic material to transfer that load to your bone without going uh, you know any change to your tissues there. So this is the explanation whatever the Pierre Brennemark has been given in his definition. So if we quote the definition word by word, it is a direct structural and functional connection between the ordered living bone. Why? Because we are preparing this bone to place this screw there and the surface of a load carrying implant. So that means your osseointegration is not only the structural connection, but it is a functional connection as well between your ordered living bone and your alloplastic material there. P.I. Brennemark is not only the person who has done so many work over your dental implants, but one of the very important person that is called Albuxton. Albuxton ने भी काफी काम किया है dental implants. Albuxton was the companion of your Brennemark. And he has got so many papers, so many researches published regarding the bone and the implants there. So he explained the osseointegration a bit differently. But if you see the mean of this definition, it's almost the same as the P.I. Brennemark presented there. It's a time-dependent healing process. Obviously, whenever we place some alloplastic material in your bone will respond uh, by producing some healing process there, whereby clinically symptomatic rigid fixation, and in response to that healing process, a fixation of your alloplastic material happened in your bone. What we used to see or what we used to desire for your dental implants and maintain in your bone during the functional loading. So this, whatever the connection is established, has to be maintained during the functional loading. Means when you put down some load over your implant, this connection, this whatever the fixation has been produced there, has to be stabilized. So this was the definition. It's almost same definition. Whatever the definition you would reproduce is it's basically a concept. What is basically happening there for your osseointegration. So this is the pictorial representation what used to happen. This, if you focus on this photograph, you would see that this is your implant or alloplastic material there. So when you put down this implant, this black is the hematoma formation initially. You know that the blood flush out in the around the periphery of your dental implant there. And this left for 2 weeks, and during the third week, your cells used to come, osteoblasts started to make the bone there, and this process left for up to your at least for 2 months there, this bone formation. Initially a lamellar bone formation used to be uh, formed there, and then this lamellar bone, means this soft bone, used to be replaced by your uh, trabecular or compact bone there. And this would take more than 2 months. At least you need 2 months, at least you need 2 months to go through this whole process. But the book says that 4 to 6 months you have to left this implant. This was presented by Pierre Brannemark in his first study there, that you have to leave your implant 4 to 6 months in situ, so that this whole process should be completed completely. If anything goes wrong this in this process there, you might form a, on x-ray you will find a black border around your dental implant. That means your bone is not responding normally. There is something wrong there, there is something erroneous, and that would lead to some implant failure there. There's no bone formation around this zone where we want to. So in other sense, what we would say that it's an osseointegration failure. That means there's no structural connection between your alloplastic material and your bone there. So this is the failure of your osseointegration. So if we want that the implant osseointegration would be there, we have to look for these factors. These are the 6 factors there. Means we always focus on your biocompatibility, we always focus on your design, we always focus on your surface of your implant, and then the implant bed, means your bone, then whatever the technique you are using, surgical technique, while doing the implant surgery. And once you have done the implant, then how, at what time you will load that implant, mean you place the crown or bridge or a denture over your implant there. So we will discuss these factors one by one. It's a complete science. You may find a complete book over your osseointegration. So we just in short, at your final year level, we discuss these things so that you should have a concept of your osseointegration. As I discussed last time, that biocompatibility is nothing but it's a quality of a material to do not deteriorate during the service. Means whatever the implant material you are placing in your bone should be stable there, should not deteriorate, means should not produce some byproducts that would produce some inflammatory response there. And in response to that, inflammatory change in your tissue environment may lead to the failure of your whatever the alloplastic material you have placed there, better to say your fixture there. So the ability of your implanted material to undergo only a minimum amount of deterioration during service, to produce only minimum change in the body, sorry, minimum change in the body, environment, and function satisfactorily in every other respect. Means in nutshell, you would say that whenever you place some material in your bone, should not produce the byproducts which are harmful for your tissues there. So there are 3 factors which determine your biocompatibility. This would make your understanding more clear, and you will understand more wisely that what is basically biocompatibility. Corrosion resistance. We know that whenever you use some metal, it has got the quality to produce certain byproducts by reacting to your environment there. So that byproduct is a corrosive byproduct. Suppose if there is some corrosion there, but the byproduct, whatever the byproduct is produced there, means your reaction to your environment, but that reactory product is not harmful for your tissue. Suppose in case of your dental implant, we used to use titanium. and this titanium used to react with your tissue oxygen there, and it used to produce titanium oxide layer. So this byproduct, that titanium oxide, is more biocompatible than your titanium. It's more biocompatible than your uh, original, whatever the alloplastic material you have used. That means your titanium. So that means why we used to use this titanium, because its byproduct even more biocompatible than this its original form of whatever the metal form you have there. So this cytotoxicity of your corrosion products is very, very important. If your byproduct is, or corrosive byproduct, better to say, is cytotoxic, we never choose that particular metal there. Then the third thing is your metal contamination. For example, your titanium is not cytotoxic, but when you touch this titanium with some other metal, it induce some, we know that oral cavity is full of your saliva there, and one of the metal would act as anode, and other metal would act as cathode, and you would establish some electrolytics, process there. So that may lead to some deposition of your other metal over your titanium, and that would lead to your failure of your dental implant. So you never make contact of your dental implant with some other metal. You always try to use either titanium product or some plastic instrument over your uh, dental implants there. So never touch your dental implant with your other metallic form there. Suppose we used to use stainless steel for your examination instruments. You never try to touch any of your instrument which is made of your stainless steel there. So these are some biocompatible materials we used to use. CP means commercially pure titanium, that is 99.9% pure titanium, but because of the strength of this commercially pure titanium, it's not that strong to bear your occlusal load. We have modified this commercially pure titanium to your titanium alloys, where we have added titanium, aluminum, and vanadium, 6 parts aluminum, 4 parts vanadium, and thereby we make the your material more stronger. We are nowadays we are using zirconium, but strength is not as good as your titanium alloys. But where you have an allergy to your titanium or other metals, we used to prefer these zirconium implants. There are certain patients who used to have metallic allergies, so we prefer these implants. It's available internationally, but in Pakistan I think it's not available right now. So we can add on certain materials over your dental implant, that are your HA, means hydroxyapatite, one of the type of your calcium phosphate ceramic material, which we spray over your dental implant. Sometimes we used to spray the plasmas over your implant in order to enhance the bone formation. So these are also biocompatible materials which add on to your dental implants there. Then we have इम्प्लांट डिजाइन. नेक्स्ट फैक्टर, फर्स्ट फैक्टर हमने बायोकम्पैटिबिलिटी को डिस्कस किया. Initially we made the implants in this form, plain implants, but what we noticed that when we put down these implants in your bone, because of this surface architecture there, they used to move, and those movements you can't see with the eye, that were micro movements, and because of that micro movements, your tissues are not be able to react perfectly there. So that might lead to some failures. In those implants, the failure were more as compared to this form of implants. अब ये अगर पिक्चर में नीचे देखें, so you have threaded implant nowadays. इसको और आसान करें, there are two type of stability. One is your primary stability and other is your secondary stability. Implants may always, whenever you put the implant, initially you always used to have initial stability, and that initial stability is purely a mechanical thing. उसमें कोई biological involvement नहीं है. Means your tissues are still not formed around your implant, and that implant is totally stable because of its mechanical properties. The strength of your bone, the form of your implant there, these threads used to engage more bone, more surface area of your implant is engaged with the bone. That's why it used to have better primary stability. और एक बात हमेशा याद रख लें, इम्प्लांट में अगर प्राइमरी स्टेबिलिटी नहीं होगी तो योर इम्प्लांट इज नॉट गोइंग टू गेट ऑसियो इंटीग्रेटेड. भले 2 मिलीमीटर आपका एपिकल इम्प्लांट जो है बोन के अंदर स्टेबल हो, ताकि इम्प्लांट आपका हिले नहीं सही से. अगर ऊपर आपके पास बोन, फॉर एग्जांपल, यू डोंट हैव दैट मच ऑफ अ गुड क्वालिटी, बट the apical area of the bone, at least 2 millimeter of your implant must be engaged by a good quality of your bone, which should not allow your implant to move initially. So if you are able to control the initial movement of your implant, means micro movement of your implants, you would have a better chance for your osseointegration. So then the next factor is your implant surface. ये जो threads हैं, इनका distance between is called pitch. The the threads per length area means the two threads, if they are placed, whatever the distance in between these two threads and whatever the depth of your the threads you have is called pitch of your threads there. So ideally it has to be 1.5 micrometer. This pitch of your threads, ये हमारा काम नहीं है, लेकिन आप जब भी कोई implant choose करेंगे, you always see whatever the surface qualities of your implant used to have. Implant company would come to you and would tell so many of the things, but your knowledge is very, very important. So you always look for that your pitch must be at least 1.5 micrometer. Then as far as you are talking about the surface, you can coat the surface, as I told you, with different materials there. जैसा कि यहाँ बताया हुआ है, reactive implant surfaces by anodizing the oxide layer, acid etching और HA coating. अभी हम बात करते हैं इसके ऊपर कि this is the mechanical thing which we used to introduce in your surface there in order to enhance the surface area. As you can see this, these threads will increase the surface area. The more bone will come in contact with your implant, and that would allow less force transmission per unit area to your bone there. So that would allow more bone formation, less force transmitted to per unit area, and enhance the performance of your implants there. So whatever we have done over the surfaces, we have two generation. First generation में हम क्या करते रहे, क्या चीजें हमने की over the surface of your implant. We have done the mechanics, means machine surfacing. We have done initially we were doing only this thing, means we were just producing the threads there only. Then what we did, we apply certain sprays over your surface in order to enhance the bone formation. These sprays were called plasma spray surfaces, and this plasma would enhance the bone formation there by these what we say, the cells of your bone formation would be would produce more bone there. That is called osseo conducive sort of thing there. Then what we did the sandblasting over your surfaces in order to produce certain micro features there. What is the benefit of these micro features? वो अभी हम आगे discuss करते हैं. Then we coated the implants with HA, means your hydroxyapatite coatings, as we discussed before. So ये first generation में था. Now we have move on to your second generation. आजकल हम क्या कर रहे हैं, हम माइक्रो रफ सरफेसेस इम्प्लांट्स यूज कर रहे हैं. अब हम मशीन्ड इम्प्लांट्स नहीं यूज कर रहे, प्लाज्मा कोटेड नहीं यूज कर रहे, हम उससे आगे चले गए हैं. सो व्हाट वी आर डूइंग नाउअडेज, वी आर टाइटेनिंग ग्रिड ब्लास्टिंग कर रहे हैं, इलेक्ट्रोलिटिक एनहांसमेंट कर रहे हैं, जिसको HLA भी कहते हैं आप. देन वी आर डूइंग सैंड ब्लास्टिंग प्लस एसिड एचिंग. ये जो है, ये जो कॉम्बिनेशन है, इसको HLA कहते हैं, जिसमें हम सैंड ब्लास्ट और एसिड एच को कंबाइन करते हैं. ऐसे इम्प्लांट्स को HLA इम्प्लांट्स कहते हैं, और ये बड़े कॉमन है आजकल HLA इम्प्लांट्स. Then only you can do the acid etching. So whenever you are preparing the implants, you just see what they have did with this implant, whether they are HLA implants or only they are doing electrolytic enhancement or acid etching or titanium grating, whatever they are doing. So, but you must prefer this sandblasted acid etching implants, means HLA implants. What it used to do with your implants? मैंने अभी एक बात बताई थी, फॉर बेटर इनिशियल स्टेबिलिटी यू नीड बेटर मैकेनिक्स, यू नीड गुड बोन, and you need good quality of the bone as well. Not only the amount of your bone, but the quality of your bone must be good. अभी qualities को भी discuss करते हैं आगे कि अच्छी quality किस तरीके की होती है implant की. But at the moment you just keep in your mind कि mechanics अच्छी होनी चाहिए implant की, bone ज़्यादा होना चाहिए आपके पास और उसकी quality भी अच्छी होनी चाहिए bone की. ये माइक्रो सरफेसिंग करती क्या है? बेसिकली व्हाट इट यूज्ड टू डू with your implants and with your tissues there. Basically, this mechanics means this microsurfacing of your implant would improve the bioreactiveness of your implants there. Means it would allow your tissues, means whenever there is a hematoma formation, it would allow more plasma protein absorption over your implant surface. And if there is more plasma protein there and your fibrin clot retention there, this fibrin is more adhesive. That's why it would allow more osteoblasts to get adhered to your implant surface there. And these, whatever the cells are there, the bone formation cells might be a progenitor cells. Not only your osteoblast, but sometimes your progenitor cells would be there that would differentiate into your osteoblast. Means आपके ऑस्टियोब्लास्ट तो डायरेक्ट आ ही रहे हैं वहां पर, लेकिन कुछ आपके प्रोजेनेटर सेल्स भी आ जाते हैं जो आपके लेटर ऑन वुड बी कन्वर्टेड इनटू योर ऑस्टियोब्लास्ट, एंड यू may have some gene expression, means allow your more cells to convert into your osteoblast, and that would lead to more bone formation. So ये जो माइक्रो सरफेसिंग है, इन पे मल्टीपल स्टडीज हुई और उन्होंने ये सारी प्रॉपर्टीज बताई कि व्हाट आर द एडवांटेजेस ऑफ treating your surface microscopically. So these are the properties you can induce by doing this microsurfacing there. So these are the different implants. अगर आप देखें ये आपका थ्रेडेड इम्प्लांट है, ये सिर्फ मैकेनिकल काम किया हुआ है इसके ऊपर, जबकि यहाँ देखें तो इन इम्प्लांट से इसकी माइक्रो सरफेस या इसकी माइक्रो सरफेस बहुत ज्यादा फाइन है. वाई? बिकॉज अगर ये देखें ये HLA इम्प्लांट्स हैं जो मैंने अभी आपको बताया था, HLA इम्प्लांट्स, जबकि इसमें आपको ये इस तरीके की कोई चीज नजर नहीं आ रही. दिस इज टोटली अ मैकेनिकल सॉर्ट ऑफ थिंग देयर. सो दिस इज योर सेकंड जनरेशन एंड दिस इज योर फर्स्ट जनरेशन देयर. तो ये भी आपकी फर्स्ट जनरेशन है, जिसमें अगर आप बीच में देखें तो ये सिर्फ आपका HA कोटिंग की हुई है और ये थ्रेड्स हैं. इसमें माइक्रो सरफेसिंग की तरफ ज्यादा तवज्जो नहीं दी हुई. दिस इज योर सेकंड जनरेशन इम्प्लांट. सो नाउ डेज यू विल फाइंड इम्प्लांट्स लाइक दिस. सो अगर आप in nutshell, I would suggest you, whenever you choose an implant, it must be HLA. Then the next factor is your implant bed. There are 4 qualities of your bone. अभी मैंने आपको बताया था कि मैं आपको बताता हूँ क्वालिटीज कितने किस्म की हो सकती हैं बोन की. So it's very, very important, the quality of your bone. And we know that there are 3 types of bone. One is, as I told you, the lamellar bone, which you used to find during the developmental stages of your bone formation. Then you have the remaining 2 forms of your implant, which we will find in a human body there. One is your compact bone or cortical bone, and other is your trabecular bone, means soft bone. तो ये 2 किस्म की bones हो सकती है. For suppose you are drilling down the implant in your bone, you may find 2 types of bone. One is your cortical bone and other is your trabecular bone. अब इसका different arrangement हो सकता है, different architectural arrangement हो सकती है, या different variations हो सकती हैं. You can see in this picture there, ये जो outer part है, this is your cortical bone. ये जो यहाँ आपको सेंटर में भी नजर आ, सेंटर पिक्चर में भी नजर आ रही है, दिस इज योर कॉर्टिकल बोन एंड दिस इज योर ट्रेबिकुलर बोन. अब ट्रेबिकुलर बोन को यहाँ देखें और यहाँ देखें तो थोड़ा फर्क है. कॉर्टिकल बोन में फर्क नहीं होता, वो हमेशा कॉम्पैक्ट होती है. लेकिन ये जो आपकी ट्रेबिकुलर बोन होती है, ये डेंस भी हो सकती है, ये स्पार्स भी हो सकती है. लाइक दिस केस, यहाँ पर अगर आप देखें तो यहाँ पर आपको ब्लैक एरिया ज्यादा नजर आ रहा है, that means this is a sparse sort of architecture for your trabecular bone. So अगर ये bone बहुत ज्यादा हो, if you have this cortical bone comparatively more along with your compact bone of your trabecular type, that is your class 1 bone, जो कि आपके मैंडिबल, एंटीरियर मैंडिबल मींस योर सिम्फिशियल एरिया में क्लास 1 बोन फॉर्मेशन मिलेगी आपको. इट्स एक्स्ट्रा हार्ड बोन, मींस यू हैव थिक कॉर्टिकल बोन भी ज्यादा होगी और ट्राबिकुलर बोन जो होगा वो भी कॉम्पैक्ट होगा. So this combination in both areas is, is presented as an hard bone for your implants. This is not an ideal bone for your dental implants. It's like, if you will go back, if you will see this first quality, this is called uh, type 1 bone, and this type 1 bone you will find composed of homogeneous compact bone, usually find in your anterior lower jaw. अगर आप यहाँ देखें तो आपको क्या नजर आ रहा है, ज्यादातर कॉम्पैक्ट बोन. अगर आपकी ट्रेबिकुलर बोन होगी भी तो बहुत कम क्वांटिटी में होगी और वो भी कॉम्पैक्ट बोन की तरह की ही होगी. Normally, what it suggests that is composed of homogeneous compact bone, means you don't find any trabecular bone there. So type 1 bone is found in your symphysial area, as I told you, anterior lower mandible. Class 2 में क्या होगा, कॉम्पैक्ट बोन बहुत ज्यादा होगी और जो आपके पास ट्रेबिकुलर बोन होगा वो भी कोई स्पार्स नहीं होगा, वो भी कॉम्पैक्ट होगा, वो भी कॉम्पैक्ट होगा. सो in type 2 bone you would have more cortical bone as far as your this trabecular bone is concerned. If it is there, yes, it would be there, 50-50 होगा, लेकिन ये भी आपका hard bone होगा, ये भी आपका dense होगा cortical bone, जो sorry this trabecular bone. Class 3 ये जो bone है ना, type 2 bone, ये हमारे लिए ideal है for your implants. So this is found in your posterior mandible there. जो आपका बॉडी है आपका, यानी आपका एंटीरियर मैंडिबल को छोड़ के जितना पीछे मैंडिबल बचता है, इसमें तकरीबन आपको टाइप 2 कॉर्टिकल बोन मिलेगा. बट दिस इज नॉट हार्ड एंड फास्ट रूल, यू मे हैव सर्टेन वेरिएशंस एज वेल देयर. वो जब तक आप उस साइट पर काम नहीं करेंगे और until and unless you don't have CBCT in your hand, you cannot say that which type of bone you have there. So then you have a class 3 bone where you have thin cortical bone, but had a thin cortical bone and comparatively more trabecular bone, but this trabecular bone is compact. It's not, sparse, as I told you, as I show you in the picture there. So then in this type, quality 3 type bone, you would have a thin bone of cortex, means hard bone is thin, but on the contrary, the trabecular bone is compact. So this is again a good bone for your implants, and this is usually found in your anterior maxilla. Then you have a type 4 bone, where you have very thin cortical bone, and you have a wide or broad trabecular bone, and that trabecular bone is of low density there. It's very sparse, more blackish area on your radiographs there. So this one is not good for your dental implants. Here the prognosis is not that good, but you can modify certain things there. Nowadays we have different techniques. We can compact the bone. We can use the surface coatings of your implant. Thereby we will give more healing time for your bone. But at the end of the day, you would have a good osseointegration for your implants there. It's not like you cannot place the implant in your type 4 type of bone there, but you have to be more careful while you are placing the implants for your type 2 type 4 of your bone there. This is the pictorial representation. Again, the revision. This is the compact bone there. This is the trabecular bone. We have different compositions in different areas there. Type 1 may purely your compact bone would be there, and your trabecular bone is almost, almost not there. So later on, if you see this In other cases, you will find, means suppose you have a type 2 bone, this is your type 2 bone, where you have a compact bone and you have a this compact trabecular bone. You have this cortical bone and compact trabecular bone. Then you have type 3 where you have a cortical bone and you have a less cortical bone, but you have a compact trabecular bone. Type 4 may you do not find or if you find a very thin layer of cortex there and very broader area of your trabecular bone, but that trabecular bone is very sparse there, very low density bone there. So and I discussed with you what you will do in type 4 type of bones there. Then you have next factor that is called surgical technique for your dental implants there. जब भी आप सर्जरी करेंगे, number one, you have to be trained for that particular surgery. Very neat and clean incision need to be given there. There shouldn't be any, trauma to your tissues or disrespect for your tissues there. And whatever the instruments you are using must be sharp enough. हमेशा आप physio dispenser use करें with proper water cooling capability of that particular instruments there. दो किस्म की water coolings होती हैं, एक internal है, एक दूसरी external है. External में पानी आपकी drill के ऊपर गिरता है, internal के अंदर drill के अंदर से पानी आता है. So the internal one is good as compared to your external cooling facility. But if you don't have internal cooling facility, but you have to be very careful कि आपने intermittent drilling करनी है, once in a while नहीं करनी. The speed of your drill must be enough. Normally 1000 RPM is recommended there. तो वो आप स्पीड ज्यादा रखेंगे तो लेस हीट जनरेशन होगी, आपकी ड्रिल शार्प होनी चाहिए. इसके अलावा जो आपकी ड्रिलिंग जो है वो उसका सीक्वेंस इट हैज टू बी प्रॉपर. ऐसा नहीं है इनिशियली आपने ड्रिल किया 2.1 का, फिर उसके बाद 2.5, फिर 3.2, फिर 3.5. डिफरेंट कंपनीज की डिफरेंट सीक्वेंस होती है ऑफ ड्रिलिंग, तो उस सीक्वेंस को आपने फॉलो करना है. ऐसा नहीं आपने 2 पॉइंट किया फिर उसके बाद 4 किया, तो उससे क्या होगा, जब आप इम्प्रॉपर सीक्वेंस फॉलो करेंगे your drill is going to cut more bone there, and in response to that there would be more heat generation there. So जब ये सारा काम कर लें, when you are placing the implant in your bone, ऐसा नहीं है कि वहां टॉर्क जब हो वो बहुत ज्यादा हो. Implant torque बहुत ज्यादा नहीं होना चाहिए. If you find that your implant is not going passively in your bone, तो उसके अंदर कुछ स्पेशल किस्म की टेपिंग ड्रिल्स होती हैं. वो टेपिंग ड्रिल यूज करें ताकि आपका इम्प्लांट इंसर्शन टॉर्क को रिड्यूस किया जाए, क्योंकि अगर आपका इम्प्लांट इंसर्शन टॉर्क बहुत ज्यादा होगा, that would lead to some more bone resorption there. Why? Because it would damage your surrounding tissues because of your excessive pressure there. आपको पता है जब बहुत ज्यादा आपका टेंशन या कंप्रेशन ज्यादा होगी उस एरिया के अंदर, तो सेल्स की डेथ ज्यादा होगी अराउंड योर implant there, and we don't want any tissue disrespect there. We have to respect the tissue so that these tissues respond properly and positively in order to form the bone. फिर ड्रिल ज्योमेट्री इज वेरी वेरी इंपॉर्टेंट. ऐसा नहीं है आप एक कंपनी एक डिफरेंट यूज कर रहे हैं और ड्रिल किसी और कंपनी का यूज कर रहे हैं, तो आपके पास जो ड्रिलिंग करेंगे आप सेम कंपनी जो भी आप कंपनी का इम्प्लांट करते हैं उसी की ड्रिलिंग ज्योमेट्री को फॉलो करेंगे. अदरवाइज यू वुड हैव प्रॉब्लमेटिक preparation of your bone and later on may lead to some failure there. तो ये कुछ चीजें हैं जब आप सर्जिकल टेक्निक को फॉलो कर रहे हैं. इंसिशन अच्छी लगाएं, कूलिंग अच्छी होनी चाहिए, शार्प ड्रिल्स होनी चाहिए, प्रॉपर सीक्वेंस या ग्रेड सीरीज जो होती है उसकी वो यूज करें, ग्रेडेड सीरीज. फिर उसके बाद ज्योमेट्री आपकी प्रॉपर या मींस सेम आप जो इम्प्लांट यूज करें, अगर आप बायो होराइजन यूज करें तो बायो होराइजन होना चाहिए. अगर आप न्यू बायोटेक यूज कर रहे हैं, हमारे पास ये इम्प्लांट ज्यादा कॉमन है. अगर आप आईटीआई इम्प्लांट्स यूज कर रहे हैं जो आपके ये हैं कहाँ का मेड है, चलें इसको छोड़ें. बहरहाल आईटीआई इम्प्लांट ये 3-4 कंपनीज हैं विच आर वी आर यूजिंग कॉमनली. तो वो जो भी हम इम्प्लांट यूज करें XYZ, but you would use a proper drill for that particular implant there. Then we have loading of your implant. means placing the prosthesis of your implants. There are different type of loading of your implants there. One is your immediate occlusal loading, means you place the crown over your implant immediately, means within 48 hours of your surgery and not more than 1 week. So it might be a occlusal loading, it might be a non-occlusal loading, means where your teeth, whatever the artificial tooth you have given over your implant or teeth over your implants might touches the opposing teeth, or they are not touching the opposing teeth, means occlusal loading or non-occlusal loading. We have divided this type of immediate loading into two groups, where you are make sure that your whatever the temporary crown you have given will make the contact with your opposing tooth, or is not going to make the contact with your opposing tooth. But in both the cases we have a special protocols, वो इस लेवल पे डिस्कस नहीं किया जा सकते. इसके इम्प्लांट्स भी, जो इमीडिएट लोडिंग इम्प्लांट्स हैं वो भी डिफरेंट होते हैं, डिफरेंट कंपनीज होती हैं, इनके प्रोटोकॉल्स डिफरेंट होते हैं. यू नीड गुड क्वालिटी बोन, यू हैव टू स्प्लिंट द इम्प्लांट्स, बहुत सारी उसके अंदर चीजें आ जाती हैं. बट एट द मोमेंट यू जस्ट कीप इन योर माइंड दैट कि हम इमीडिएट लोडिंग भी कर सकते हैं इम्प्लांट की. So this is might be a last slide. ये शायद लैपटॉप बंद हो जाए. लो इसकी चार्जिंग लो हो रही है. लेकिन अर्ली लोडिंग में क्या करते हैं, विद इन 1 week और 2 months, मोर नॉट मोर देन 2 months. वी विल वेट फॉर 2 months में कर लेते हैं जहां आपकी क्वालिटी ऑफ बोन, ये कन्वेंशनल इम्प्लांट्स में भी कर लेते हैं, जहां आपकी क्वालिटी ऑफ बोन बहुत अच्छी है, उसका बोन रेस्पॉन्स बहुत अच्छा है, यू कैन लोड द इम्प्लांट्स within 2 months. Then you have conventional loading, जिसको आप delayed loading कहते हैं. उसका प्रोटोकॉल ये है कि for mandible 4 months, for maxilla 6 months. Why? Because in maxilla you have soft bone, और अगर आप का जो है वो posterior maxilla है, bone की quality बहुत अच्छी नहीं है, तो आप कभी कभी उसके अंदर 6 महीने से भी ज्यादा का टाइम दे देते हैं. यू यूज टू गिव मोर, और उसमें अगर आप 6 महीने में कर रहे हैं तो आप प्रोग्रेसिव बोन लोडिंग करते हैं. प्रोग्रेसिव बोन लोडिंग में क्या होता है कि आप इनिशियली जो है एक्रेलिक का दांत लगाते हैं, उसके ऊपर आप पोर्सलिन या मेटल यूज नहीं करते. देन यू यूज टू गिव सॉफ्ट डाइट टू योर पेशेंट, के उसको कहते हैं जी आपने सॉफ्ट डाइट यूज करनी है, आपने हार्ड डाइट नहीं लेनी, पास्ता और राइस और इस तरीके की चीजें. यू नेवर अलाउ raw meat and some hard stuff there to use initially for 2 months. फिर जब 2 महीने गुजर जाते हैं, you used to change that prosthesis with the permanent prosthesis. That is called progressive bone loading. तो आजकल ये कॉन्सेप्ट बहुत फॉलो होता है, प्रोग्रेसिव बोन लोड. ये स्पेशली इन इमीडिएट लोडेड इम्प्लांट्स के अंदर ज्यादा यूज होता है. उसमें हम प्रोग्रेसिव लोडिंग करते हैं. इनिशियली आप एक्रेलिक देते हैं. वाई? बिकॉज एक्रेलिक यूज टू हैव लेस occlusal load transmission of your implants there. तो आप जो है पहले उसको एक्रेलिक लगा दें, फिर कुछ अरसे के बाद जो है 2 महीने के बाद, और उसको सॉफ्ट डाइट परमिट करें इनिशियली, और उसके बाद जब वो टाइम गुजर जाए तो slowly and gradually you will convert that prosthesis with your permanent prosthesis, and you will allow sequentially your patient to use the raw food there. So thank you for today. Next time inshallah हम जो हैं वो, अच्छा इसमें एक स्लाइड है जिसमें हम फोर्स यानी मैकेनिकल फैक्टर्स को डिस्कस करते हैं. मैकेनिक्स में हमने बहुत मोटी मोटी चीजें देखनी होती है. फोर्स का मैग्नीट्यूड, अगर स्क्वायरिश जॉ है आपके पास, बड़ा साइज है फेस का, तो इसमें फोर्स ट्रांसमिशन ज्यादा होगी. जैसा कि मेरा फेस है, मेरा फेस स्क्वायरिश फेस है, मोर मैस्कुलर फेस है, तो हमारी फोर्स occlusal लोड्स ज्यादा होंगे ऐसे पेशेंट्स के अंदर. देन अपोजिंग डेंटिशन आप देखें, नेचुरल है या उसके ऊपर एक्रेलिक लगी हुई है, या उसके ऊपर कोई मेटल सेरामिक के क्राउन्स लगे हुए हैं, वो भी फोर्स की ट्रांसमिशन को बढ़ा देते हैं. उसको कहते हैं प्रोस्थेसिस टाइप. अगर आप एक्रेलिक का प्रोस्थेसिस लगा हुआ है, डोंट वरी, उसमें आपकी फोर्स ट्रांसमिशन 60% रिड्यूस 40% रिड्यूस हो जाती है, 60% रह जाती है. देन यू हैव अ प्रोस्थेसिस मटेरियल, मैंने अभी आपको बताया वो मेटल है, एक्रेलिक है, टाइप आपको टाइप भी उसी में आ जाती है, ब्रिज लगा हुआ है या आपका पार्शियल डेंचर लगा हुआ है. इम्प्लांट डिजाइन क्या है, आपके जो इम्प्लांट्स लगे हुए हैं उनका डिजाइन थ्रेडेड है, लॉन्ग इम्प्लांट्स हैं, सरफेस कोटेड हैं, तो डोंट वरी. अगर आपके लंबे 10 मिलीमीटर से लंबे इम्प्लांट लगे हुए हैं, do not worry about the forces. Ideally it has to be more than 10 millimeter. Number and distribution of your supporting implants, आपने 3 की जगह अगर 4 इम्प्लांट यूज किए हुए, अब सपोज आपके पास अपोजिंग डेंटिशन में मेटल सेरामिक्स के का ब्रिज लगा हुआ है बड़ा, तो आप 2 की जगह 3 इम्प्लांट्स यूज करें, एक एक्स्ट्रा इम्प्लांट यूज करें, प्रोवाइडेड अगर आपके पास लेंथ प्रोवाइडेड नहीं है। फॉर एग्जांपल आप यू हैव 10 मिलीमीटर इम्प्लांट और लेस देन 10 मिलीमीटर, तो आप 2 की जगह 3 इम्प्लांट यूज करें, so that your implants would be able to bear the occlusal forces there. Then bone density, as I told you, अगर type 4 bone है, again number of implants को increase किया जा सकता है, width of implant को increase किया जा सकता है, surface modifications की जा सकती हैं, more time दिया जा सकता है for your bone healing. ये सारी चीजें एक दूसरे के साथ